everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Indomethacin. Its brand name is Indocin. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Indomethacin is an NSAID, or non-steroidal anti-inflammatory drug that has anti-inflammatory, antipyretic, as well as anti-pain or analgesia effects. Inhibition of cyclooxygenase, that is COX-1 and COX-2, which lead to a decrease in prostaglandin synthesis, is thought to be its mechanism of action. In terms of indications for use, this medication can be used for rheumatoid arthritis. It can be used to treat acute, mild, or moderate pain. There's a place in therapy to use this medication to treat osteoarthritis, as well as gouty arthritis in acute situations. And finally, it can also be used in the treatment of ankylosing spondylitis. Now, before somebody was to use Indomethacin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have asthma-like reactions, urticaria, or other allergic-type reactions after the administration of aspirin or other non-steroidal anti-inflammatory drugs. It would also be contraindicated in patients with a history of proctitis or in those who have recent rectal bleeding. It would be contraindicated in patients who have had hypersensitivity reactions or serious skin reactions to Indomethacin in the past or to other non-steroidal anti-inflammatory medications. It would be contraindicated in patients who have a hypersensitivity to Indomethacin or any other component of the product. And its use in the setting of a CABG or coronary artery bypass graft surgery setting would also be contraindicated. Now, in terms of precautions, it's important to note that cardiovascular thrombotic events, myocardial infarctions or heart attacks, as well as strokes, have been reported in patients using Indomethacin with or without cardiovascular disease, as well as in patients with or without risk factors for the development of cardiovascular disease. This medication is also on the Beers criteria, which is a list of medications that the elderly population should either avoid or use very cautiously. We would want to try avoiding to use this medication in the elderly population because there's an increased risk of gastrointestinal bleeds, peptic ulcer disease, as well as acute kidney injury. It should also be noted that Indomethacin has more of a likelihood to cause adverse CNS effects when compared to other NSAIDs. Anaphylactic reactions may occur in patients with or without known hypersensitivities to Indomethacin. Patients with asthma should be made aware that changes in their asthma signs and symptoms may occur with the use of this medication. Bleeding events may occur with this medication. This would be more common in patients who have coagulation disorders or in patients who are using this medication and also using warfarin. It's not recommended to use Indomethacin with other medications from the non-steroidal anti-inflammatory drug class or NSAID class. Patients should be made aware that this medication can mask signs and symptoms of fever as well as inflammation. Fluid retention as well as edema may occur with the use of Indomethacin. Hyperkalemia or high potassium levels may happen in patients using Indomethacin who don't have renal impairment. New onset or exacerbation of hypertension or high blood pressure may occur with the use of Indomethacin, and this could put patients who have cardiovascular disease at an increased risk of experiencing a cardiovascular event. You would want to avoid using this medication in advanced renal disease unless the benefits of using the medication outweigh the risks. If it is to be used in these patients, monitoring would be recommended. Some serious skin reactions may develop with the use of Indomethacin, such as exfoliative dermatitis, Stevens-Johnson syndrome, as well as toxic epidermal necrolysis. If signs or symptoms of any of these manifestations occur, the medication should be discontinued. Now, after somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Indomethacin, there's a couple different ways they can receive their dose. However, today we're just going to talk about the oral formulation, that is the capsule formulation. If somebody is using Indomethacin to treat their acute, mild to moderate pain, they may use 20 milligrams 3 times daily, or some other patients may use 40 milligrams 2 or 3 times daily. If somebody is using this medication to treat their acute gouty arthritis, they would typically start with an initial dose of 50 milligrams 3 times daily. They would use this dosing regimen until pain is tolerable and then taper the medication based on pain response towards discontinuation. In ankylosing spondylitis, the medication will be started off with an initial dose of 25 milligrams taken 2 or 3 times daily. The dose can then be increased in weekly intervals by 25 or 50 milligrams, until sometimes reaching doses as high as 150 milligrams or 250 milligrams daily. In terms of maximum doses, the maximum individual dose would be 100 milligrams per dose, and the maximum daily dose would be 200 milligrams. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using indomethacin, so I'll go over some of those here now. 1 to 3% of patients may experience abdominal pain. Constipation falls in that same percentage of 1 to 3%, and so does diarrhea, so this may also happen in 1 to 3% of patients. Indigestion may happen between 1 and 9%, and 3 to 9% of patients may experience some nausea. Some patients may experience increased liver enzymes. 3 to 9% may experience dizziness. Headache falls between 11 and 16%. And somnolence, as well as tinnitus, fall back within that 1 to 3% range. Now, some more serious side effects would be hearing loss. This happens in less than 1% of individuals. Nephrotoxicity or renal failure. This is also very rare. And finally, persistent pulmonary hypertension of a newborn falls below 3% of the time. That's all we're going to talk about today with indomethacin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.